transform because obviously this surge, it's a little hot right now for the kids to be in class, but when people talk about a return to normal, face-to-face instruction is definitely one of the biggest parts of that. It's 7:37. Let's go ahead and head into the KUAM newsroom now, or Zoom room, where we have standing by from the Guam Memorial Hospital, the administrator, Lillian Posadas, on this Tuesday that's kind of like a Monday. Good morning, Lillian.
Good morning. Good morning, Guam. Good morning, everybody.
Hi, Lillian.
Almost scared to ask. But go ahead.
We are at 31. We are at 31 this morning. Over the weekend, we were up to 34, the highest we've been. But that's just inpatient individuals who are admitted. We were still seeing patients coming through the emergency room, quite a bit of them. Fortunately, their symptoms were not so severe that they qualified for the Regenco, and so many of them were given that infusion treatment and were discharged, were able to be discharged home. So this morning we are at 31. One of them is at the ICU level of care, receiving a high flow nasal cannula oxygen supplemental treatment, not on ventilator support. So it's a good sign. One is at the PCU level of care, meaning progressive care unit, still kind of close to ICU, but not as critical as ICU. 15 of these individuals required telemetry service, which is, again, the constant monitoring of their heart rhythm and heart rate. 12 of them are on medical status, and one we have individual in the labor and delivery area, one female individual who also delivered and is COVID positive. So we're seeing more and more of the maternal child health, client population coming in with COVID positive.
You still seeing sick kids cycling in and out of the ER?
We are still seeing, yes, children, not as much as previously. The two children that we had in the house last week, the one under 1 year was released home, I believe, Friday. And then the other one under 12 was released yesterday or Sunday.
Oh, that's good.
Have you ever had to use the antibody, the monoclonal treatment on children?
No, they haven't. I think the monoclonal is for individuals, for young people 12 and over, not under.
So no one over, I guess, over 12,
right.
Between 12 and 15. No. So can you tell us more about this rollout? Because you guys have been offering this Regenco, Regeneron treatment, but has it stepped up recently now that they're making referrals over at Teason?
Well, it's stepped up. One day, I think it was last week, Friday, we administered like about 7 COVID individuals were given the Regenco. There was one day that 11 infusion were given. But we started the team, the ER, and our under the leadership of Dr. Agun, we started giving the Regenco about 4 weeks ago. We've been giving it in the emergency room, for individuals who meet the qualifications. And so it's been ongoing since then.
Is Regenco, and I think I asked this before, is it the same thing as Regeneron?
Yeah, it's a combination of casirivimab and imdevimab. Okay. Yes, it's a mixture of the two. And so it's given over an hour infusion, and then the individual is observed for another hour to see if there's any reaction.
And so
it replaced, remember the bamlanivimab?
Right.
Right. It replaced it because bamlanivimab, ever since the Delta variant started showing up, the bamlanivimab was no longer effective. And so the pharmaceutical companies, they came up with the Genco, which is the casirivimab and imdevimab. Tongue twisters.
And this Regenco, is this something that Health and Human Services or the federal government, FDA, whoever, is providing to the government of Guam?
Yes, we've been getting it from HHS.
And how much, I guess, have you guys been getting it? How much do you guys receive?
I can't say how much. I'll have to check with our pharmacy. How much have we been getting already? At one point, we received, I believe, 100 doses, and we gave about 25 to GRMC so they can start administering the infusion treatment.
And so, is this through IV or through the sub-Q, the shot?
No, it's through intravenous. We haven't done the sub-Q yet. It's intravenous infusion.
And are you guys expected to receive anyone from HHS to help augment some of the medical staff that are coming in through that FEMA medical assistance program? Chima was talking about HHS, and they're sending a team over. So I was just wondering if GMH, if you guys are going to be receiving any of these medical professionals that are coming in from HHS.
We'd like to, absolutely, because we really need additional resources, and so we'd like to, but we're also trying to get more travel nurses. It's just that we're challenged, with the competition at the national level, and so it would definitely help us if we get additional medical staff from FEMA, and so we're anticipating, we're hoping to get some assistance.
How many travel nurses do you guys have currently assisting?
Last count last week was about 42 travel nurses.
Mm-hmm. And when's their
combination?
When's their contract up to leave?
Some of them, their deployment or their assignment year ending this month, and so we've requested for replacement. And so some of them have decided to stay on and extend their assignment here in Guam, but not a whole lot.
Wow. Is there any issues with like payment, or are you guys behind, or you guys are current?
We are behind, but we are making payment every 2 weeks, so because it's a huge expense, but we are making payment every 2 weeks to both the two staffing solution agencies, New West and Medical Solutions. Mm-hmm. We continue to make payment, although we are behind.
Right. Yeah. How far behind are you guys?
I think one of them is about 1 million that we're behind, and then the other one close to 1 million in terms of back payment that we owe.
Have any of the companies said, look, you need to pay up, or we're going to cut you guys off?
Well, but they've been very, very cooperative, and they've been really just, good faith. They know that, that we make payment, and so they continue to provide us with the resources. Unfortunately, the demand for these travel nurses at the U.S. Mainland level, it's great across the nation, and so they're also trying to supply those hospitals across the states who are in greater number of COVID cases, taxing their hospital system, their healthcare system.
Do you or has GMH or the governor made that request? I remember last time when there was the surge, I think the Department of Defense came through and they sent some people over. Has it gotten to that point, or has this request been made?
Yes. In our discussion yesterday with the governor, that we are going to meet sometime today to, begin the process of completing those documents, those forms, to get some mission. They call it mission assignment. So they'll be deploying. Hopefully, that they can deploy some DoD medical staff, doctors and nurses, like we did last year. But I'm sure they're also tapped on throughout the U.S., but, doesn't hurt to try. And so we are going to sit down and go through the completing the form, the request for mission assignment of DoD personnel.
And this is those critical care nurses I forget the specific titles, but I know they had long titles and they were very important.
Yes.
Yeah. There's intensivists.
Yeah.
The intensivists, yeah, those are the doctors. We do have, fortunately, we have the telemedicine intensivists, 3 doctors helping Dr. Algren and the hospitalists. But, doesn't hurt to request for additional help and support for intensivists and also for the emergency room and for telemetry nurses, because a lot of these COVID patients require constant cardiac monitoring via the telemetry system. And so, the numbers are high. I think even, was it yesterday, over the weekend, we had like about 20 plus COVID patients who needed the telemetry service.
Lillian, we had a question here. Does a patient have to be insured to receive the Regenco?
No, we absolutely not. They don't have to be insured. What we can do is assist that individual to be processed for Medicaid or MIP. But absolutely not. It doesn't, there's no bearing in terms of ability to pay to receive the GEMCO.
I wanted to get your reaction from that. It was a really long public hearing last week on those 2 bills. I think one was from Senator Moylan, the other was from Senator Frank Boss Jr. regarding the mandatory vaccinations and fines and I mean I
testified.
Right,
I testified. I was one of there. But
there were so many people also that testified in support of the bill. Sure. And I just wanted to get your response because it was very emotional. People were, very upset.
Well, I mean, I am too. I'm disappointed that, and I have mentioned it before, it's not about individual freedom, individual rights. We as a community, a citizen of our island community, we have a responsibility to not just, my own personal right that again, the mandatory vaccine is not forced. You're not forced to receive it. Just like you're mandated to have a driver's license, correct? You're mandated to follow the traffic law, the traffic lights. But if you choose not to have a driver's license and you're out on the road driving and you're caught, you get cited for it. You pay the consequences. Our responsibility as citizens of our own community is to help prevent harm, help promote the health and safety of the entire community, not just my own personal. And so, again, it is our responsibility, it is our duty to participate in promoting the health and safety and preventing the spread of this infection by getting vaccinated. No one's forcing you, but if it can get you to be vaccinated, it certainly can help minimize the spread and minimize the severity, the acuity of individuals needing hospitalization when they do get the COVID. Just like the flu vaccine, we're required to have a flu vaccine. Other vaccinations, we're mandated to get the vaccines. And so, again, it's to promote and prevent further harm of individuals in our community. Protect our families, not just myself, but our entire families and, the entire community of Guam.
Yeah. Lillian, I get where you're coming from because, you see it every day. You're right there in the thick of it, right?
Yes, we're the ones seeing it here. We're the ones seeing these individuals have a difficulty breathing. We're the ones holding their hands. We're the ones feeling for these patients when they're suffering, when they're struggling for that breath, And so, please, again, think of the bigger picture. Think of your responsibility for the greater good of our island.
Lillian, as we start to kind of get to that place where we need to get our booster shot, right? If you see a lot of the literature talks about the waning vaccine efficacy, right? And so what would you say to those people? Because, I get where you're coming from, but when you just look at the numbers, the black and white of it, especially on a day like today, we've seen the vaccinated hospitalizations are accounting for half of the hospitalizations, and that's been increasing over the last couple week, right? It's been creeping up on the unvaccinated. So do you know, like,
Not,
what? First of all, just what would you say to those people who look at this and they go, "Oh well, why should I even take it?"
well, why not? Why not take it? At least you're protecting yourself to some extent, but at least you're doing that part. We have individuals here in the hospital who are unvaccinated, have been here for over 2 weeks, still struggling with their breathing, still struggling and needing supplemental oxygen because, unvaccinated. It takes them longer to recover, and they need more supplemental oxygen. And so, again, getting vaccinated helps minimize the acuity, the severity, and the long term of staying in the hospital.
So Lillian, with these vaccinated people who are in the hospital, do you know like when they took the vaccine? Was it early on? Is that maybe why they're in the hospital? And then, if you could, because right.
Some of them, yeah.
Okay, go ahead.
Some of them, yeah. Some of them, especially like in the elderly population, where they were the first here to receive the vaccination. They got it in January, February. I have to look at the list and see which ones got it early on and how long they've been here. And so there is a possible correlation.
Right. And then the vaccinated patients that you do see in the hospital, because again, we were told that it helps stave off serious illness and hospitalization. Is there a difference between the vaccinated hospitalized and the unvaccinated hospitalized in terms of like their degree or the severity of their illness?
There is a difference. I see it. Yes. A couple of them who are unvaccinated had to come into the ICU level of care because of their compromised respiratory system, and so they needed to be on the high flow nasal cannula oxygen or even BiPAP. And so, yes, those who were unvaccinated had to come into the ICU.
So if you're saying that we're seeing vaccinated people in the hospital who took the vaccine early on back in January and they're so ill that they're requiring hospitalization, do you want to speak to the importance of the third shot, and maybe do we need to like start making it available now?
Yeah. Well, yeah, and that's what we're also talking about it with our team of physicians here. That why not? Why can't we just go ahead and give the third dose since we have it available already? It's the same, same vaccine that we all got, and so we're seriously thinking that maybe we can go ahead and start giving the third dose. But we're waiting for public health guidance on that one. So. They're the boss. They give us the green light.
Are we still working to increase capacity, given that the numbers keep climbing?
Oh, absolutely. We are. We do have the need to increase our capacity in terms of bed. It's just now the challenge is the staffing. We need more nurses and we need more healthcare professionals and healthcare workers. We even have, we put out a call within our own hospital to see if we can get some people to be watchers or sitters for some of these patients, not just the COVID patients, but also non-COVID patients who, need close monitoring, close sitting and watching so they don't fall off the bed. They don't, some of them are confused. And so we want to make sure that they don't fall off or, hurt themselves.
Right.
Anything new with the SNU?
No, we continue to, maintain our capacity at 25 right now. We are at 25. And so, we continue to see which patients here on the acute side can transition over to the SNF. We're waiting for FEMA to give us a green light so we can proceed with the construction project to separate out the wings in terms of the HVAC system.
Okay.
Lillian, we're getting Teresa Ariola on from Jibwick and a few, but just these alarming statistics where we're seeing 18 suicides reported in the first 7 months of this year.
Right. Yeah, not only does this COVID really affect the physical medical condition of individuals, but psychosocial also. And it's a very tough illness. It's there's a lot of anxieties, a lot of fears, and a lot of concerns. And so individuals, even healthcare workers here, we're dealing with some traumatic cases that from last year still. And so we're human beings, and so our emotions are all in disarray and concern and worry. So we all need help.
I totally agree, Lillian.
Yeah.
Thank you so much for your time this morning and for continuing to be that voice of safety and caution.
Yeah, and care for the people of Guam.
Thank you, Lillian.
Thanks, Lillian.
Thank you too. Take care.
You
Take
too.
care.
7:58. We're going to take a break. And are we going on KUAM TV today? Yes, we are. Oh, that's good. We're coming up on KUAM TV next, Jay.
Yeah, I was thinking about something because, Lillian keeps saying this, for like going on basically a week and a half now is, it's your inherent responsibility to take care of yourself, your family, but also your neighbors. That, if you didn't know, is the essence of Inafamalik. She didn't say it as such, but that's basically what what she just broke down there. It is important for each of us to do what's right for our neighbors. And you said it yourself. What'd you say, Chris? Like, your grandpa's no longer with us, but if you did even thought about doing something that made yourself stand out, or, you didn't offer somebody that visited your house like an extra scoop of rice or do like something like that, what would your grandpa do to you? He'd light you up.
Yep, that for sure. 7:59.
I was thinking about my grandfathers this past weekend, both of them and everything, like what they would tell me to do.
Oh boy, yeah, they would. They'd definitely have a lot to say. That's for sure.
And you'd have a hard time sitting down for about the next 2 days.
It's 7:59. We're coming back on KUAM TV next. Good morning.
We got your 6.